I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. Today, we are discussing minority mental health awareness. As most of you know, July is Minority Mental Health Awareness Month, and I have here with me today Dr. Napoleon Higgins Jr. Dr. Higgins is a psychiatrist, medical physician, and mental health nutritionist in the Houston and Clear Lake City area. He is also CEO and president of Bay Pointe Behavioral Health Service and Southeast Houston Research Group. He also practices as medical director of Hold My Hand Residential Treatment Center. Dr. Higgins has worked with and founded many programs that help to direct inner-city young men and women to aspire to go to college and finish their educational goals. He has worked with countless community mentoring programs and has special interests in trauma, racism, and inner-city issues and how they affect minority and disadvantaged children. Please welcome Dr. Higgins.
Thank you so much, Sabrina, for allowing me to be on today. This is a very important topic, and I'm just delighted to be able to share information with your audience about the issues that we have present in the Black community when it comes to mental health.
Thank you so much. Could you share with us some statistics about behavioral health disparities in the African American community today?
There are multiple disparities in mental and physical health when it comes to African Americans. We are 20% more likely to report serious psychological distress than our white American counterparts, according to the U.S. Department of Health and Human Services. And there are many reasons why that might be. It's, too often we believe that there is this one particular thing, but it's really a set of things that can lead to that. One I would mention is just, poverty is more likely to affect African-American families being, and that poverty is 3 times more likely to make you have psychological distress. The issue of ongoing issues in our country and racism and how doctors see patients and how patients see doctors, and that breakdown of trusting the medical model, which causes many people to delay getting help. So often you'll find that African-American families and patients will see the professional or the mental health professional as the last step before they receive the last step of help versus the first step of help. So I would say that when it comes to the disparities, many times we will go and seek treatment, but we will go to family members, we'll go to the church, we'll go many other places before we actually go to the professional to get ourselves looked at and to disclose our information. So, and the question becomes, why is that? And a lot of that is stigma of mental health, miseducation of mental health, and just fear of the entire mental health system, where a lot of African Americans can be very distrusting of the overall medical model. Seeing that, African Americans are 10% more likely to report having serious psychological distress than our white counterparts. And that is huge. When you're looking at disparities, that 10% more is many times the difference along with other factors. And the other thing that I hope that we could get to at some point is looking at the suicide rate among African American adolescents and even youth, where those numbers are going up, are sadly skyrocketing currently in American society.
Right. What do you think are some of the major reasons for these disparities? I know you touched on some of them, but is it, sort of like you said, in terms of why there could be resistance for the African American community to seek the kind of more traditional mental health treatment available? Is it because there are these sort of cultural boundaries and there are things that are not being addressed within the medical and physician community that would better serve this community?
Definitely. When you look at mental health, it's, psychiatry, it is a social science.
Right.
And so the social issues that occur in America affects outcomes, and realizing that Americans are not a monolithic group. So one of the major issues is the lack of culturally relevant behavioral health providers. Realizing that Black psychiatrists make up about 2% of all psychiatrists. So there is an issue in America where there's not enough psychiatrists, but then when you're 15% of the population, only 2% of the psychiatric group is of your race or of your color, that can cause persons to not come in, because most times, patients want to know that their behavioral health provider is culturally relevant to what they have going on. They want to make sure that they're understood, and they want to make sure they're not being judged. And those judgments are true in that you find that African Americans are more likely, or twice as likely, to be diagnosed with schizophrenia than the general population. Now, understanding that there is not a schizophrenia gene in a color of someone's skin,
Right.
that is the
Right.
misdiagnosis and the misunderstanding that can become from a whole host of reasons.
Mhm.
Realizing that many times African Americans will be seen as being more mentally ill than another counterpart coming in. Some of that can be even be language and the way we discuss our mental health and how we describe symptoms, and that it may not fit the latest DSM on how we explain what is actually going on with ourselves and with our minds. That difference in culture, that difference in language, that difference in understanding, and many of the stereotypes from both the provider and the patient all come into the room together. And too often in psychiatry, we're not trained to understand that there are other factors outside of the diagnosis that actually will cause persons to make a particular diagnosis, pick a particular treatment, and culture affects outcomes. And when the doctor and doesn't recognize that, that can be a problem. Well, so often patients recognize that culture affects outcomes, and therefore, when you don't have a behavioral provider who doesn't look like you, who's not from your culture, or sadly doesn't understand your culture, that can cause major disparities in treatment and care.
Absolutely. I think that was so well put. Thank you. Now, what are some of the obstacles that minorities face when seeking treatment for mental health issues? Can you go into that? I think you touched on some of it.
Well, access to care is going to be a huge part of that. So
Right.
even with, Affordable Care Act, ACA, you'll find that many African Americans, we still lacked the ability to get in to see a psychiatrist and have coverage. So historically in the United States, African Americans are less likely to have insurance coverage. Even with ACA, I believe the numbers were nearly double the general population of African Americans who still did not have health care. And you see that play out to this day.
Wow.
So those issues and obstacles are relevant and apparent even till this day. So not being able to find culturally relevant psychiatrists, and then on top of that, not having insurance,
Mhm.
and then many blacks will end up in systems such as Medicare and Medicaid because of poverty and social circumstances. At that point, politics then affects how you receive care. So the next presidential race or the next president, persons can be on insurance and then be off insurance, or the way insurance is done can be completely changed within the state when it comes to Medicaid, and then with the federal government when it comes to Medicare, which this is directly impacting our families. And then also you're looking at obstacles of just lack of mistrust of the entire medical system that we talked about before, the stigma, the lack of awareness, and just not trusting what's going on because of just a lack of knowledge.
Right, right. What do you think could be done to better serve this community within the mental health field?
Well, one thing that we could do right now is people need access to care. So we need enough psychiatrists. We need more psychiatrists. We need more black psychiatrists. And when looking at that, many of those numbers will take time. But having psychiatrists who culturally understand the community is key, is number one. And that's what much of what we're
Right.
doing right now is trying to educate the community about mental health and educate the psychiatric community and the providers about culturally diverse mental health care is something that we could do right now to help improve those numbers.
Right. I love that. And I love how you describe that sort of reciprocal relationship, that it's just as powerful to, not just to educate the psychiatrists, but then also the community about their own mental health. I think that's great. And I think that that is something that is so important just in general for physicians to understand and be aware of cultural differences, because you're right, that doesn't come in, the standard medical training, right?
So often it
It's
does.
something that we have to sort of work to develop. So, yeah, I think that's excellent. Now, with that being said, what are some of the ways in which we could put this into practice to try to improve cultural competency? Are there workshops or educational material that should be distributed? How do we get sort of the more how do we get that clinician community more involved in just awareness and education about cultural competence?
Well, one, engagement. We have to be able to engage in a safe place where persons can mention what are their issues, what are their problems, what is their lack of understanding, both from the patient population, but also from the professional population. So often, I think we're
Right.
in a society that can be very judgmental, where essentially, if you say the wrong thing during the conversation, or have the wrong belief that is not or of what society says is in style at the moment, many times persons will be judged for making an honest, you know, I would say an honest opinion about what they think is going on. So we have to be able
Right.
to discuss these things, talk about these things, not run away from it, but actually to, completely engage in society and going through what's going on. And that's the only way that we can make a difference, is that we've got to start these conversations. We've got to talk about it. I would say that, so often, even within the community, we within the Black community, we have difficulty talking about the unresolved traumas and the issues of slavery, and how we can see America differently many times than other populations inside of
Right.
the country. We just don't many times want to share that, even as a community, because of the shame and the trauma and having to relive the past. But also realize that many times people are really living in the current. The microaggressions that people do on the work, on the job, how many times we can see things very differently, hear the same set of words, see the same television, I don't know, news take, and you have
Right.
completely, totally different ways we've perceived that inside of the room. So we have to talk about that on a community level, but also in a mental health level, realizing that the social issues that are going on in the country also impact what is going on inside the individual clinician meeting the consumer or patient in the room. All of that is coming in together, and we've got to be able to have a better discussion about that in order for us to move forward.
Right. Absolutely. What underlying stigma about mental health issues in the African American community could be the reason that the majority of patients in this community tend to delay seeking treatment for mental health, and they tend to rely primarily on religious organizations for help? I've seen that research suggests that they'll tend to go to churches and things like that before, going to that traditional sort of treatment option.
Well, you have the issues of, you know, the stigma. It continues to be a huge issue where folk do not feel as if mental health is actually for them. I've heard well too many Black people say that, well, I'm not mentally ill, I'm Black. Only white people have mental health issues. And I've even heard Hispanics say that only white people have mental health issues. I've heard Asians say that only
Wow.
U.S. people have mental health issues. And I've heard
Wow.
poor whites say that only rich white people have mental health issues. So the fact is that no, mental health hits all people, all populations across all segments of society, culture, race, income, continent. It does not matter. Mental health happens to everyone. So realizing that we believe that it happens somewhere else, not understanding that it actually happens in our homes, and it can happen inside within ourselves, but that comes from an issue of a lack of education and knowledge. Now, I would also say that when it comes to community delaying seeking treatment, I question that if that is occurring. And when I say that, I'm referring to many times we'll talk to our friend, we'll talk to our mother, we'll talk to a coworker, we'll talk to a classmate, we'll reach out to someone other than a mental health professional for mental health treatment and care, and that's where so often we're seeking our treatment first. It's not until we get into some serious type of trouble that we tend to seek out mental health care with a professional. I do child, adolescent, as well as adult psychiatry, and too often I'm seeing a kid once they're in CPS care. If I see you in CPS care, then more than likely the kid is going to perceive me as the problem, not as the solution, because you've already been taken out of the home and there's been some sort of judgment, or there's been some sort of legal issue, or I've seen you first for the first time in juvenile treatment. versus you actually walked in and understood your mental health and you actually came out seeking care. Actually,
Right.
too often I'm seeing as the punishment. And oddly enough, for many times with the kid, I'm actually your biggest advocate, not your punishment, but that by the time you get to me, you've actually shut yourself down.
Yeah. Wow.
Now, so often we also go to religious reasons, religious organizations for help, and that's historical within the African American community. And I would say that's even historical to America in that when you look at the church historically, we've had the separation of church and state. So in America, no matter what was going on, the church was always an independent body. So as black people in the US, even when you go back to slavery, the church was always a safe haven because it was not connected to the federal government. It always had that
Mm.
that that arm's length space. So essentially, I may be a slave
Yeah.
here, but when I go to church, I can be somebody. I could be separate from the federal government. So the pastor or the preacher or the deacon or the ladies of the church would have the ability to have kind of free reign with inside of that source. So if you look at the civil rights movement, be it Martin Luther King or even Malcolm X, all of those leaders, most of that leadership came through the church itself. So that's been a place for us, realizing that also African Americans are very religious people inside the United States, with 90 to 95% of us claiming a religion, and almost over half of African Americans will be at church more than once a week or more than once a week. So
Okay.
that has been our safe haven, and religion has been something that we've always turned to, being that we are the most religious group in the United States. Now, inside the church, I see a lot of mental health issues inside the church. I'm a regular church goer, and I play bass in the church. So grew up in the church, and I used to go to church probably about 4 or 5 or maybe 7 days out of the week in my youth. So I've seen a lot of mental health inside the church, but also church kind of serves as a group therapy for African Americans, realizing that they're talking about a lot of mental health principles inside the church. But that could be both good and bad depending upon the person who's saying the message and their knowledge of mental health. But also, I've seen an awakening inside the Black church in recognizing mental health. I've probably done more speaking and talking in Black churches in the last 5 years than I had done in the 10 years before, simply because people are recognizing, pastors are recognizing, churchgoers and church members are recognizing that there is a mental health component even to your spiritual health. And my argument many times inside the Black church is that I believe God works in the spiritual, but he also works in the physical. That God will put physical people, even medicate physical medications, and make them available to you for you to get the help that you need, and that it's not all spiritual. If you're hungry, you can pray to God to eat, but if you got a plate of food in front of you, you need to eat the plate of food that's in front of you versus doing the prayer about when can I get something to eat. So the physical nature of what we do is something that we have to get across to populations. And I would say the church is doing a better job of that. But at the same time, I've heard a lot of bad information come through the church as well, which will cause people to stay away and not realize that there are other modes of help out there, and that it's not an either or. Your spiritual versus your physical help for your mental health can be an and.
Right. Right. Can you speak to the relationship between mental and physical health, especially in the minority populations? I know this is something that you're very passionate about, and I was wondering if you could share this with us.
Definitely, there's a relationship between mental and physical health, in all populations, but in particular minority populations. I saw a patient recently where I was talking about the patient's weight and what we needed to do about her weight. And she was upset with the conversation, saying that I'm here for my mental health, not for you to talk about me needing to lose weight. And my explanation to her is that your mental and physical health go together, in that it is not normal to find somebody who is physically ill who's of good mental health, especially even when it comes to acute or chronic conditions. So the two go well together. Whatever helps your heart, whatever helps your diabetes, whatever helps your cholesterol, whatever helps your blood pressure, when it comes to nutrition, also helps your mind. The two go together. What helps
Right.
your heart helps your brain. What helps your brain helps your heart. And what you eat and your nutrition can change how you feel within seconds of putting the food into your mouth or even with the anticipation of the food. And then, depending upon the decision you made, will make a difference on how you feel 30 minutes later, an hour later, a day later. And if you have a pattern of poor eating, it will make you feel sad and depressed on a regular basis or fatigued or tired. Now, when it comes particularly to minority populations, you'll find that we have issues with what are called food deserts, or I've even heard now the term apartheid with food, where essentially many neighborhoods in inner cities do not have adequate food places where you can get fresh foods. Too often, you'll find families shopping for food at the gas station or at the dollar store where there is not fresh food there. So the need to be able to eat the right fruits and the right vegetables and the right combinations of foods many times can be lost because you've got to now travel outside of your neighborhood for adequate food. I can even see that in my area, depending upon which way you approach my house, gives you different socioeconomics and different minority statuses. And the food coming from this direction versus that direction, this grocery store versus that grocery store of the same grocery store has different types of foods. Now, some of that could be the issue of food knowledge and information, where the higher socioeconomic status individuals will more likely pick the correct foods, and maybe persons of poverty or lower socioeconomic economics will not, but also what kind of food can you afford becomes an issue, and then the availability. So if I walk into, say, the grocery store nearest my office, which is more minority based, lower SES, there are certain foods that are just not inside the store. I don't know if it's just me looking for the food,
Right.
and no one else is buying it, so that's why it's not shelved. But the other issue becomes it's just not there. So when you're looking at poor nutrition, your brain is not able to run very well off processed foods and things that are poisonous or dangerous to the body. So when you're ingesting, high amounts of fast food, you're ingesting canned goods, you're ingesting things out of, I tell people, bags, boxes, jars, and cans are things that you have to be very careful of if that's the primary portion of your diet, which then can affect your brain. And that particularly can affect minorities, both with low socioeconomic status, but also of food availability to you.
This podcast was brought to you by the Neuroscience Education Institute. Founded in 2000, our mission is to bridge the gap between the most current neuroscience research and clinical mental health care so that you can provide the best, most effective evidence-based treatment for your patients.